Hi, I'm Jodi Reinhard, and I'm here again with Sarah Olson, and we are to talk about our mental and emotional health, especially not only through the coronavirus, but also now through the riots and the protesting.
Yes. Hi, thank you for having me. So I know that people are kind of struggling with both things
Yes.
right now. And I think that, well, first of all, starting with the coronavirus, I think just kind of going at your own pace and kind of doing what's best for your family or for yourself is probably the best thing to do right now. And not really comparing yourself, to your neighbors or the Joneses, that expression. Because you need to do what's best for you. So if staying home is best for you or getting out cautiously is best for you, I think that that's kind of the best thing to do. For what's best for you and your family. I hope people aren't living in fear per se. You see reports about the numbers and that kind of thing, and I think, again, just living cautiously, and I still do worry about people's mental health during this.
Oh, very much so.
I think it's a very real thing. I know that I think substance abuse we will see a rise with that, depression, anxiety, that kind of thing. I think I'd mentioned in the last video, reach out to professionals, reach out to your
Yes.
your primary care provider. They're always a good place to start. If you're having that difficulty, they're a really great place to start because they can get you linked up with services or mental health providers in your community. Is a good place to start, and even possibly reaching out to a friend and just saying, I'm having a really hard time.
Right.
Because things still are not back to normal.
No, they aren't going to be for a while, I don't
No.
think. Yeah.
No. And then with all of the chaos that's going on in our country right now, it's very scary.
It is.
And it's very, very sad. And I think at this point that it's, like with the coronavirus, it's almost like what can we do besides be compassionate and kind? And I think sometimes too limiting that media intake can be so huge, because what we put in our minds, can have such a profound effect on our mental health. And not that I'm saying please be informed, I think that's very important,
Right.
but constantly watching
Yes.
the media can really affect us, whether that's social media, whether that's TV media, that kind of thing. I think can really can affect us, and I think ways we don't realize. So be very particular about how much you intake, what you're intaking. I think we definitely need God right now, a lot of prayer, and to come together as a community and as individuals, and to reach out to our neighbors and our families and friends, because this is so much is out of our control, and we definitely need God in prayer right now.
We do. That's true. And Denise and I were talking how you need laughter.
Yes.
Because everything is so depressing right now.
It
And
is.
so just a little laughter or some lightheartedness is called for. And that's why I watch or look on Facebook, and sometimes I just laugh at some of the funny things people put on there, and that's so therapeutic.
It is. It really can be. There are some funny things, that are on Facebook and stuff, and sometimes some things people can put very controversial things too, but there are definitely some lighthearted things, out there, and just getting, even out of the house just to, again, go for a walk, and trying to be with nature. Right now today it's raining.
Not today.
Not today. It's really raining hard, but being with nature and getting that exercise.
Yes.
And
Very much.
deep breathing. There's even there's what they call a grounding exercise. It's really good for anxiety, and it's actually about our senses, and it's 5. So if you're feeling very anxious or you're having a lot of depression, but it's a little bit more for anxiety. So you've got that knot in your stomach, you're just really unsure about a lot of things. So you want to sit there and just kind of deep breathe. And then you want to think about you want to look at 5 things you can see. So you want to look at, so I can see a chair, I can see the really pretty welcome sign, the wall, I can see the camera, and I can see the lighting. And 4 things I can feel. What it's doing is it's distracting myself from that anxiety, what's making me anxious. So it's 5 things I can see, 4 things I can feel, 3 things I can hear. What can I hear? I can hear the rain, and I can hear some stuff going on in the sanctuary. And I think I hear a TV maybe right now. 2 things I can smell, and then 1 thing I can taste. I've got a drink right here, it's got some flavoring in it. So again, it's 5 things I can see, 4 things I can feel, 3 things I can hear, 2 things I can smell, and 1 thing I can taste. So it's called a grounding exercise. So it's distracting me from what all that anxiety is from. You can do it with your children, you can do it with yourself, you can do it with your spouse. So maybe that kind of helps a little bit.
Yeah, that'd be kind of a fun game to play with the kids.
It could be. It really could be. You can do it with any age, but I wanted to share that in hopes that maybe it can kind of distract people maybe from some anxiety and just kind of just center you a little bit. So I wanted to share that.
Okay, well, thank you. That's
You're
really
welcome.
nice.
You're welcome.
Do you have anything else for us today?
I don't right now, but I hope everybody takes care and takes care of each other and
Absolutely.
their families right now. And we just all need to come together as a community and love one another and be kind and compassionate. So
And less social media, less news,
that's right.
and more positive things. So we need to look for the positive things.
Absolutely.
All right. Well, thank you so much for coming and being with me.
You're welcome. Thanks for having me. I really appreciate it.
All right. Thanks.